Hi everyone! Welcome to breastreconstruction.org. I'm Bianca from the breastreconstruction.org team, and today we're going to be talking about BRCA, breast cancer, and self-advocacy, and I'm really honored to be joined by Brandi Williams, who will be sharing her personal story navigating diagnosis, reconstruction, and the healthcare system as a veteran. If you're joining us live, feel free to drop any questions in the comments, and we'll try to get to as many as we can throughout the conversation. For anyone new here, breastreconstruction.org is a nonprofit dedicated to providing educational resources and support for people exploring breast reconstruction after mastectomy. Our goal is to help patients better understand their options so they can make informed decisions with their medical teams. Tonight, we are joined by Brandi Williams, a 21-year Air Force veteran and breast cancer previvor who carries a BRCA2 mutation. Brandi was diagnosed with triple-negative breast cancer at age 42, and despite years of regular screenings, she ultimately underwent bilateral mastectomies with expander to implant reconstruction. Today, she's passionate about helping other veterans navigate breast cancer care and understand the resources available through the VA. And here... Hi,
Hey,
Brandi. Thank you so much for joining us.
thank you for having me.
Hello, hello. Well, let's jump right in.
All
Um,
right.
the first question I have, can you please share a little bit about your background as a veteran and where you were in life when you received your breast cancer diagnosis?
So, where I was in life, I had been retired of maybe 3 or 4 years, and I was actually planning to start my clinical licensure. I am a social worker. That is what I started my degree in. I started while I was still active duty and finished after I retired. So I was starting my clinical hours, and that is what was going on in my life when I found out about my diagnosis.
Wow. Wow. And what was that like? Like, what did that feel like during everything you had going on at the time?
I wish I had a word for it. It was, it's just like I finally decided to do this because I had been hemming and hawing whether or not I really wanted to do it. And then this comes up, and the thing about it is, I actually was looking into getting preventative mastectomy because, excuse me, my provider that I had just started seeing was like, hey, have you considered this? And I was like, no, at the time when I found out I had the BRCA2 mutation, I was just like, oh, they said people did that, but it was kind of not really a common thing then, because this would have been back in like maybe 2011. So I just did surveillance, and I was like, if it happens, I'll get a mastectomy, and that'll be that. So that was the lens I always operated from. So when my
Right.
new provider was like, well, would you consider this? I'm like, sure. So I was in that mindset anyway, and then I found this lump, and it's just like, I wasn't expecting that.
Right. And so you had been doing regular screenings for years.
hmm
And
I was
so,
doing MRI and mammogram, as well as the transvaginal ultrasound for ovarian and the CA25 marker
right.
testing.
So you found the lump after you had a clear mammogram. Is that
Mhm.
what happened? Wow. And so what did that experience teach you about trusting your body and advocating for yourself?
It taught me, like, all those women that say, you're like, know your body, make sure you check, all that kind of stuff. All that stuff is true. And what I would even add to that is it doesn't have to be like a formal check, because I didn't find it doing what they teach you, like
Mm,
moving in the circle. And I was telling someone the other day, I can't really remember exactly what I was doing, but I know I was doing something where I was touching my breast, and I just happened to notice something felt different,
Mm,
and it didn't feel normal. So,
yeah. Well, you learned years earlier that you carried a BRCA2 mutation.
yeah,
And how did having that knowledge ahead of time shape the decisions you made after your diagnosis?
I think because I knew I had BRCA, I decided back then that if I had cancer, I was getting a mastectomy. I wasn't going to take any chances. I mean, I've
Yeah.
seen what cancer does, not just with people in my family, but also in my work. I worked in a hospice organization for a year and a half. I also did my practicum with hospice as a student. And so I had some opportunities to see with any kind of cancer, like not just breast cancer, all kinds of cancer. I know what that does to you. So if there's something that I can do to make sure that the risk is less, I'm going to do it.
Yeah. And so you had a mastectomy. Did you have any treatment along with that?
Yes, I had chemotherapy and then I took olaparib for a year after.
Mm. And what was that like as a veteran, as a woman, like just what was that overall experience like for you?
Well, there's so many ways to go with that. Um, First of all, going through the mastectomy
Mm-hmm.
and losing your breast, it doesn't matter, or at least in my experience, it didn't matter how much I was prepared for it. My surgeon, I love her. You know, she prepared me. You know, when you see your chest post op, it's gonna, she prepared me as best as she could, but there's really no preparation for that.
Yeah.
And then for whatever reason, I was not able to, some women can do direct to implant.
Mm-hmm.
And I wasn't able to do that. They didn't want to do that. They figured I would need chemo. So, and maybe it was because it's triple negative. So I had to go flat first. And that was the most jarring experience the first time I saw that. Like, I wailed like a baby. Like, just, how sometimes babies, they just cry, they just get really loud. Like, that was me, like, ah! Like, yeah, it's really bad.
Yeah.
bad. So, very jarring experience, that part. And then recover from that, roll into chemo, and then you figure out getting sick. And everybody's a little different, but it didn't matter what combination. I took the anti-nausea meds. I tried everything. I was always sick
Mm.
after Red Devil. Taxol didn't make me sick really, but all 4 rounds of Red Devil made me sick, and the fourth round was the worst one. I did not consume food for like almost a week. Like I couldn't even keep water down. That's how bad it was that last round of
Mm.
AT. So it's hard, and it is hard watching your hair fall out. And I was that person that I need to see what's going to happen. I didn't want to just shave my head. I
Mm.
wanted to see. I'm like, what's going to happen? I wanted to see what was going to happen. So that's why I didn't shave my head. And watching that happen, that was very hard. Looking at myself and like seeing the transformation. Like, I don't have eyebrows. I don't have eyelashes. Whoa, I don't have hair anywhere. Like,
Yeah.
crazy experience. Yeah.
Yeah. How long did it all take to fall out for you? I ended up shaving like pretty immediately after it started falling out because I was so irritated having to vacuum my hair up. It was really
Oh,
annoying.
yeah.
So how long for you did it take to fully, fall out?
So I was a every 3 week. And after that first set of 3 weeks, I started seeing light shedding. And I
Mm,
wanted to try the cold capping. And the cold capping company was like, well, you can still try it because even though you got it late, 'cause I got it after my first treatment. But after that second time, and I got really sick, and my hair got matted, and I tried to wash, and it was just coming out, I went on Walmart app and had clippers delivered to me with I paid the extra for the express so they could get delivered me to me in the hour, and I just shaved my head then.
mm,
So I guess about a month.
yeah, okay. Mm. Well, as a veteran using VA and Tricare coverage, how did navigating care differ from what people with private insurance might experience?
I would say in some ways it was easier and in some ways it was harder.
Mm,
So the surprisingly easy part was getting my mastectomy done. That got done within a month of my diagnosis,
oh, wow.
which was really good. And then, I healed from that, and chemo was shortly thereafter. So, from that perspective, it was good. But when it comes to the VA, if they're not able to get you in within a reasonable time, they send you to the community. And sometimes, especially here in Vegas, waits can be long. And fortunately for me, really my only wait was plastic surgery, which
Mm,
is partially like, well, that's just aesthetics. Like, surely you can wait, be thankful that you're alive. But on the other hand, it's like, well, I'm tired of being flat chested. Like, I want breasts again. Like, I know they're not real,
yeah.
but like, I want to look like a girl again. So,
Hmm. And you had expanders in?
hmm.
Were they doing fills? Or because you had to wait for the plastic surgeon, you weren't getting fills
Oh,
immediately?
no, I didn't have expanders after my mastectomy. So what I had my mastectomy, I had chemo, and the first surgery I had once I got into the surgeon was fat grafting. I didn't so
Oh,
because
okay.
my skin was so thin, so they did fat grafting to thicken my skin, and then I got the expander. So I'm trying to remember the time frame of everything. I didn't I didn't even get fat grafting. I got diagnosed in 2023 of June. I didn't even get my fat grafting until October of 2024.
Oh, wow.
And I got my expanders in March of 2025.
Got it, got it. And so how long did you have the expanders in before moving to over the muscle? So you were over the muscle, by the way?
Yes.
Okay.
Yes, over the muscle. So I got they took the expanders out and put the implants in August of last year. So a few months. Yeah.
Okay. Um, Many people don't realize that there are different types of mastectomies and reconstruction options. So what do you wish you had known earlier, and what helped you feel confident in your choices?
What's funny is I don't really have to wish I knew anything because I'm one of those people that I go and seek information. And when I was first thinking about a preventative mastectomy, I just started looking things up. And I
Mm.
remember realizing that they take your nipple, and I'm like, they take your nipple? Like, I can't imagine that. Like, it was so distressing to me, which some, again, people probably like, girl, why are you worried about that? But it's like, I want my nipples. So I ended up doing a lot of research on my own, and my mastectomy surgeon, she told me about the options as well. By the time she told me about the options, I already knew them.
Hmm.
I did a lot of researching on my own, and that's how I found out about cold capping. That's how I found out about the different types of mastectomies. I did my own research, but the Mayo Clinic has a book, and I can't remember the name of it right now, but it's a book all about things breast cancer, diagnosis, the different types of breast cancer, the possible treatments, the what types of mastectomies, what kinds of reconstruction. It's a pretty big book. And I checked that book out from the library, and then I checked it out like the physical book, and then I checked it out again digitally. So that was a good resource for me to learn a lot.
Yeah.
So that's how I ended up knowing things. But I will say my surgeon did make sure that she told me those things as well. So I
Hmm.
really don't have to, there's not anything I say I wish I knew because I kind of learned it on my own before anybody even had the opportunity to educate me.
Yeah. What advice would you give veterans who feel limited by provider lists or long wait times?
Well, I would say advocate for yourself because this is not something that should wait. So, for example, when I first found the lump in my breast,
Hmm.
when I called and I was like, I want to get an appointment, I have a lump in my breast. And initially, it was like I had to wait a little bit to see my primary. So I'm like, all right, whatever. But then after I saw my primary and she referred me to the surgeon, and I make that appointment for the surgeon, and they're like, it's going to be another month. I was like, well, this isn't okay. Like, this is a lump in my breast. Like, I know y'all can go faster because I've seen y'all talk about this in press. So I know you can go faster. So, the person who's answering the phone, they're just scheduling appointments. They're just like, well, this is what we have. So I called the patient advocate because I wasn't okay with that. And that's how I got in a lot quicker. So I would, for veterans specifically, I would say, call the patient advocate. But even if you're not a veteran, if you're navigating private, insurance and private doctors, there's probably someone within the organization that can advocate for you. I don't know if that's like a navigator, if that's the title, but I feel like there is probably someone in there, or if you just speak up for yourself, people are more apt to help you. I
Yeah.
can recall a time during this process, I needed to get the follow-up screenings, and I needed a diagnostic mammogram, and I needed, I believe, an ultrasound.
Hmm.
And they want you to do both on the same date. And it was a little too long for my liking for me to be able to get them both done on the same day. So I just talked to I remember her name. Her name is Courtney. I wish I knew her last name so I could send her some flowers. I was like, look, I have been like waiting, and I know these things got to be done together. I was like, I will drive to whatever part of town that I have to get this done, but like I need to get this done soon so that we can get this going. Like I've already had to wait with the VA, and like this, I can't do this. And she did what she could do, and she said, you might have to wait a little bit, like in the sense of like I'll get one test done, I might have to wait, and then the other test be done. I was like, I'm okay with that. I just want them done as soon as possible. I gotta stay there all day. I'm okay with that. Like I'll bring snacks, and so I really appreciate that. But if I wouldn't have spoke up, I'd have just had to wait, and then I'd have had that on my mind, like what's going on while I'm waiting for this screening to be done
Yeah.
or this imaging to be done.
Well, you mentioned a VA patient advocate. Can you explain a little bit about what they do and why veterans should know about that resource?
So a patient advocate is essentially just like what it sounds like. It's a person who you go to if you're having issues. So it's not necessarily specific to this circumstance. It could be anything with your care, whether it's having difficulty accessing one of your doctors or if you're feeling uncomfortable with a provider, anything with any providers or access to care, anything that if you've tried navigating with that clinic already and you feel like you're not getting any recourse, that is what I would say the patient advocate is for. They're there for you to make sure that you're taken care of. And while I'm not informed on every branch, I would assume every branch of the military had a patient advocate in, because I remember like even in our active duty hospitals and clinics, there was always a patient advocate or multiple patient advocates, I should say. So it's a term that veterans probably would be familiar with.
Well, for veterans who are newly diagnosed and feeling overwhelmed, what are the first three things you would encourage them to do to advocate for themselves?
Mm. I think being definitely being a voice, like kind of being, what's the word I'm looking for? Maybe the squeaky wheel, being the squeaky wheel. If you're not getting what you know, even if you are getting what you need, like being proactive. And I think that's what helped me out a lot. And I think that's what made a lot of people want to help me because I was so proactive.
Mm.
People, and it's not to say that they don't want to help anyone else, but I think, well, I don't think I've been told that a lot of the things that I brought up, it helped them learn. And so now that's helping all of the other patients that have come after me.
Mm.
So I would say being the squeaky wheel, being mindful with your research. So I always say if you're a very anxious person, don't do research. But because it might freak you out. But if you just, well, like you want to know what's going on, do research, but be mindful of where you're getting that information from. Maybe it's a Mayo Clinic, maybe it's an MD Anderson, maybe someplace maybe that is known for their care, especially cancer, breast cancer, whatever. Because if you at least kind of have a loose understanding of what's going on, it does help you better advocate for yourself. Because I was that person, I was like, why do I need chemo? I was thinking that in my head. I'm like, why do I need chemo? And so I looked and I looked and I looked, and everywhere mentioned chemo being a standard treatment for triple negative breast cancer. But it also explained why. Like, it's a very aggressive cancer, it has a high recurrence rate. And in my case, while it had not spread to my lymph nodes, it was in my lymph vessels, which is still concerning. So even another reason to do chemo, but I felt better in knowing that I researched that for myself. I didn't just take the doctor's word for it. Nothing's wrong if you do, but sometimes it's like, do I really need all this? And even when the oncologist that I had at the time, she wanted me to do olaparib after chemo. She ended up leaving the VA, so then I was switched to another oncologist who was like, "Oh no, you don't need olaparib." And I'm like, "I think I do though, because I know I looked this up." So I looked it up again, and I read everything, and I went back, and I was like, "Well." This time I talked through the nurse navigator, and I was like ready to change oncologists. I was like, I'm like, this is what the previous oncologist said, and this is what the study says. Yes, I did go look up the study. As boring as they are to read. I said, this is what the study says. I think I'm supposed to be doing this. And then they came back and was like, yes, you were right. We just made a mistake, which people are human. They're gonna, you
Yeah.
know, but that's very important because we, I wouldn't have been comfortable knowing that my like I would have needed to get a third opinion, and that another person would have had to say no, you don't need it in order for me to be comfortable with not having it. But I also feel like me looking it up on my own, and not just looking it up on my own, but bringing the actual information showing that I looked up that information myself, like I can look up information too, I think is helpful than you just saying, well, I don't think I need this.
Yeah. Wow. Well, now that you're on the other side of treatment, what motivates you to support other veterans with breast cancer, and what message do you most want them to hear?
What motivates me is that when I was looking for things, I can only find people who were not veterans, which obviously veterans aren't that large of the population as a whole. But it's very hard to find other women veterans who have gone through this and navigated VA and who could give you advice. I know they're out there, but maybe they're not on social media, or, maybe, there's an age thing, maybe these veterans are older or whatever. And it's wonderful to have support of other breasties and, the support that they give, but navigating private sector versus navigating VA, it can be different.
Mm-hmm.
So having that's one thing that motivates me. I like being able to say, oh, this is what I did. I actually just did it for someone in the last month. Someone we share a person in common, and that person said, hey, would you talk to her, she's having some trouble. And so I've been talking to her and letting her know, hey, this is how my stuff went, that doesn't sound right, maybe ask these questions. And like, I was like, okay, well, my oncologist is the one who answered this types of questions, so maybe you need to talk to your oncologist, and these are the ways to talk to your oncologist, because we have what we call what is it called, like a secure message through our portal. So I'm like, send them a message through the portal, someone will answer you, like, instead of like calling on the phone and then waiting on hold.
Yeah.
So that gives me satisfaction that maybe I could keep someone from just thinking that they have to sit and wait,
Mm-hmm.
just kind of spreading information that I didn't have at the time when I was going through it.
Yeah. Well, before we close up, is there anything? Oh, hold on. Yeah, you're very right about being your own advocate. I had an invasive lobular cancer with 2 to 4 lymph nodes involved. I did do research, but my breast surgeon was adamant for just a lumpectomy. Yeah.
Yeah, and that's another thing too. Everybody's gonna be different with what they want, and I definitely understand wanting to have a lumpectomy versus a mastectomy. Again, that is so jarring, but I personally couldn't even entertain a lumpectomy because I would always be afraid of it coming back.
Yeah.
And I do still have a fear of that. That's that, because as much as the risk is lowered, it's not zero.
Mm-hmm. Right.
So yeah, but what she's saying is, yes, getting your own information, because they're also, what I've seen is a lot of people are leaning more towards lumpectomy because they're saying that it doesn't. I can't remember exactly what the verbiage was like, but it was almost like it doesn't change recurrence rates, or like it's not different, or it doesn't change if you'll find it, because people are more likely to find their own cancer than the screenings and that kind of thing. To which, okay, fine, but there's also a mental aspect of that too, which is so very important. It's many women that, whether it's through my support groups or just seeing people talk on social media, there's a lot of fear in just that mental health perspective of it, or aspect of it, where women are having a hard time, but they're still powering through because that's just what we do. I'll even speak for myself. I powered through, but there are definitely, I'm not going to say it's easy. Today I slept until 8:30, got up, did a few things, and then went back to bed because I did not want to be up today.
Mm-hmm.
I really didn't. I would love to be like in the bed with the covers over my head right now.
Mm-hmm. I hear that.
So it's tough. So to not give someone all of the choices and make them feel bad for picking one choice or another, that's so not okay.
Yeah.
If someone wants to get a mastectomy versus a lumpectomy, then that's their choice. If someone wants to get a lumpectomy versus a mastectomy, that's also okay.
Yep. I totally agree. And I also went the mastectomy route. I ended up having breast cancer in both breasts, and
Mhm.
we didn't know about the other one until the mastectomy.
Wow.
So yeah, it didn't show up in imaging. So I think we should all feel like we have all of the information and resources and education, and that we have surgeons and doctors that help guide us and also support ultimately whatever decision we choose, because
Yeah.
we have to live with it.
Yes. Yes. I was very fortunate that it was all of my providers have been great, which the VA gets a bad rap, but all of my providers through the VA have been wonderful. I think at any place you're going to get the providers that aren't that great, but I've had a very positive experience. I would recommend them over and over. My surgeon, Dr. Jobs, my nurse practitioner navigator, Dr. Coleman. Well, she's a DNP.
Hmm.
Um, my both oncologists that I had, well, all of them. I'm on my third one now, but all of the oncologists I've had, um, even radiology. The radiologist who put my report in, I just knew he was going to be mean, and he was like the kindest person and just really assuring and the best bedside manner. I was so pleasantly surprised. I'm like, see, I shouldn't be judging. I shouldn't be making assumptions.
Yeah. Well, before we close out, is there anything else you would like to say that we didn't get to talk about?
Hmm, that's a good question. I feel like we talked about so much, and I feel like after we go off, I'm gonna be like, I should have said this. But just, I think, like I said earlier, if you're anxious and it's really gonna get to you to look up things, don't look up things. But if you do need to know things, look them up. Just make sure it's reputable. Seek out people. Seek out the most out of resources. I wish I'd have had TikTok when I was first going through this journey, but definitely I did a lot of looking on Instagram, but use Instagram, use hashtags like hashtag breast cancer, hashtag breast reconstruction, TikTok, obviously breastreconstruction.org. I probably found you guys through Instagram. Forest Facing Our Risk of Cancer Empowered, they provide a lot of resources. There's so many. things out there. There's the breasties, there's for the breast of us. I'm going to be going to the For the Breast of Us Baddie Con for the first time this year. The breasties have their breastie camp. You know, there's a lot of ways for you to get connected with the community. Find organizations in your local community. There's organizations that can help you with mastectomy packets. Like one of the organizations where I live in Vegas, Las Vegas Breast Cancer Warriors, they make, I'm gonna call it like a kit for
Oh,
for women who are going through a mastectomy. They have the pillow, and maybe they have some bras, and the things like clothes where you can put the drains in your pockets and all those kind of things. So many resources. So look for those things in your community. Look for them online. I think as time goes on and more women are out there, we'll soon have an abundance of resources to where it's like, oh my God, like I don't even know which resources to pick because there's so many of them.
yeah, totally. Well, thank you so much for sharing your story and your perspective with us today.
Thank
Conversations
you.
like this are so important and help so many people feel more informed and less alone in their journeys.
Yes.
And thank you to everyone who joined us tonight and spent part of your evening with us, and those of you commenting. If you found this conversation helpful, or if you joined late and you want to watch the full thing, this replay will be saved on our YouTube channel. You can also visit breastreconstruction.org for more educational resources, patient stories, and information about breast reconstruction options. And if you'd like to stay connected with upcoming conversations, resources, and events, you can sign up for our newsletter through the link in our bio. Thank you all again for being here, and we will see you next time. Thank you so much,
Bye.
Brandi. Have a
Thank
great night.
you. You too. Bye bye.
Bye.